What are some common things that can go wrong during castration surgeries in horses?
So castrations are the most common surgical procedure done on horses. As you can imagine, most male horses are castrated. But what people don't realize, it's also one of the most problemsome. It's you're removing a whole organ system. The testicles actually descend from the abdomen, so you have an open incision. There are safer ways to do it and less safe ways to do it, and the most common way that's done is in the field on the farm, mostly because it's cost effective and the complication rate is low. But if you do have complications, which mostly are minimal, swelling is the biggest complication. The holes that you leave open to close are usually can close up too soon if you don't do enough exercise, and that's a complication that you worry about. But some of the complications, like bowel coming out, which we call evisceration, or some other internal parts hanging out, or a bad infection, can be bad and costly, and people don't think about it. But if you really weigh the risks of castration in the field versus castration in a hospital, you still end up in the field, even if you have a complication, spending less than you would sometimes doing the whole kit and caboodle platinum care castration. So the things that people don't think about when they're doing castration is the fact that there is a small chance of a horse having a fatal complication like bleeding or evisceration where the bowel comes out. But in most cases, the complications you see are swelling, discharge, a little bit of drainage. And that happens in upwards of 20% of the cases roundabout for having some swelling. But it's still a fairly safe procedure. People just have to know the risk before they get into it.